Thank you very much. First and foremost, I'd like to thank the organizer for having me this evening. And very good afternoon to everyone, mainly to all the speakers, as well as to Dato Amar Sim, who is actually officially present today to share some of his wisdom about the medical care in the country. Now, I was asked to talk about regenerative medicine. And what is regenerative medicine? I would like to talk about, perhaps we'd like to share in terms of what is regenerative medicine. And certainly, I think things are evolving very fast. And more important, we will hear from the expert, Professor Angela and etc., to talk about the detail of what they are doing today. But what is regenerative medicine? Now, if we look into the definition of regenerative medicine, it is a field that whereby, the body will try to repair and replace the damaged cells, tissue and organ. The question is, to restore the normal function, often utilize some technique, but automatically, if we have an injury, the body will try their best to heal. And this is where we try to optimize the resources that we have in terms of to heal and repair the damaged tissue or even organ. And there are other mechanisms that we look into it today. Even they have found a drug, for example, that can grow your teeth rather than you use implant. And this is an ongoing research. And this is possible because now if you have the technology and know how to regenerate the tissue and organ or etc. And obviously also we talk about a normal function of the restore the normal function, utilizing techniques like stem cell, tissue engineering, and stimulate the body to repair, the mechanism to repair and to return back to normal function. And this is the bird's eye view of what regenerative medicine is all about. It's not new, but now regenerative medicine includes growing tissue and organ in the lab. For example, we have done this before. If, for example, you have a burn and you have not enough skin, we can culture the skin in the lab and use it back in your body. And it's much better to use your own cell so that the rejection will be much lower. So this is the concept that we look into the regenerative medicine. And obviously now with the progress of knowledge, we are embarking on stem cell research, progenitor cells obtained via directed dedifferentiation of all the cell therapies and induce the regeneration. That means we can induce the body to regenerate by biological active molecules given alone or as a secretion by infuse the cell and the transplantation of the in vitro grown organ and tissue. So if you can actually grow the organ or the tissue skin is an organ, and if you can use it, and obviously then you can manage the injury that you have, for example, burns and etc. So this is the concept. If you look back 19th century, they talk about skin graft. Skin graft is a form that you can take the skin, for example, from your thigh and then auto-transplant to your other burns area or injured area, and that is one that you can do. And now even, as I mentioned earlier, you can actually grow the skin graft, grow the skin in the lab, and then once you have enough skin, you can use it for skin is the organ, use it for the body, for the injured body. So advance in organ transplant to restore the structure and the function of the tissue or organ. Now, tissue engineering then regenerate and grow the new cell. So now they have the knowledge to grow new cell, and obviously cellular therapy led to the stem cell research. So a lot of research been done in the stem cell whereby try to identify the area of injury and you try to grow the cell in the respective area. So the first cell therapy were intended to slow the aging process, and that has been done. Now, if you look back in 1930, inject cells of young animals into the patient. And in 1956, they tried to use to treat leukemia by injecting bone marrow from a healthy person to a patient, particularly identical twins. So the rejection rate will be less. But if you use some other people's tissue, then there will be rejection. And this is where sometimes we need to control the rejection rate. So in 1992, a new branch of medicine that attempts to change the course of the chronic disease, regenerate and failing organs. This is chronic disease and to regenerate the failing organs. So if we have a failing organ, if we have the knowledge and skill, we can grow the organ and hopefully we can replace the organ in our body. This is the concept. In 1999, they restore to normal function that which is damaged by the disease, trauma, or worn out with time. So one good example, if I mentioned earlier, is the skin. But now we want to embark more than the skin. Is it possible? I shared just now is the growing new tooth in our body. And this is a challenge. And now the study has been done. What about growing new organ in our body? So these are all a lot of uncertainty, and we need more clinical trials and research. Now, in 1995 to 1998, that's where the human embryonic stem cells and human embryonic germ cells was introduced. And stem cells therapies and multiple research has been carried out, namely the cord blood and hematopoietic stem cells, only the blood cells, and also the pluripotent stem cells that have not been differentiated, eventually will differentiate to the common tissue or organ of the respective body. So we need to have the technology to stimulate the growth and tissue becomes, cells become tissue, tissue becomes organ, and make sure that actually they have a function. So for example, when they have myocardial infarct, some of the tissue in your heart already died, infarcted. So can they use stem cells to replace some of the dead tissue and return the function back to normal again? So I think these are the concept. Now, we have just gone through the pandemic COVID-19, which is the infectious diseases. But now our challenge is a non-communicable disease. And you see, we mentioned 3+1. Today, you look into why Malaysians are living longer since 1950, because the life expectancy is increasing. But the new benchmark is 120 years, but we have not reached it now to 120 years. But you see, over the years, those days, I think about 40 years ago, when you retire, then probably you have another 1 or 2 more years only, at age of 50. But we have actually come a long way from 1950 to 2023, where lifespan has increased about 70, now about 80. And obviously, if these are all the reasons attributed to good quality of life and longevity, mainly better healthcare, access to the hospital, clinic, trained medical professional has improved significantly along with the vaccination. And vaccination is one of the public health, second public health initiative that saved many lives. The first is the clean water, second is the vaccination. Obviously, then we look into the improved living condition, clean water, better sanitation, safer housing, and etc. So all this improves and contribute to longevity. And I recently spoke to Tun Mahathir, and I asked him, what is your secret in terms of living until 100 years? So he told me, one thing is that, when you retire, you don't stay at home. Retire means change job. I mean, retire from the public sector, then now you work in a private or academic institution. If you do not have a job, after retirement, just sit on stay at home, watch TV, and then all the diseases will come. So you must actually continue to keep active in terms of physically and mentally, and this is important. So obviously you see economic development, a growing economy has led to better jobs, better income, and access to better healthcare and nutrition. This is a key. And a lot of this is done by the government initiative, and you need a strong political will to make a difference to create a better environment for the people. That's the reason why our lifespan had increased about 80, and we look forward to see whether Sarawak government can actually prolong the lifetime to more than 100 or even 120. Just a matter of time, perhaps. Now, obviously, now the greatest challenge is 3+1. That is diabetes, hypertension. These are the challenge that we have. You can see now in terms of life expectancy, we are increasing. But the disease burden of non-communicable diseases also is increasing. Diabetes, hypertension, hypercholesterolemia, and now challenged by obesity. So these are also increasing. So what we in the Ministry of Health before, we try to shift the pendulum from curative to preventive. And preventive means take good care of yourself, good physical health, good mental health, and perhaps with preventive measures, we can actually prolong our longevity. So look at this data, you look into diabetes. 1 in 6 Malaysians above 18 years old have diabetes, and 1 in 3 Malaysians have hypertension, and 3 in 10 Malaysians have high cholesterol. And these are the challenges that we have. Physically, they are not active. Obesity is increasing. 1 in 2 Malaysians have a BMI of more than 25. So these are a real concern that we have, because you look into this data that shows, the challenges that we have today in terms of non-communicable diseases. And this is why, if it's not managed well, diabetes, hypertension, you get all the complications. More important is that the numbers, if you are 60 years and above, 50% of the population, 60 years and above have 2 comorbidities, either diabetes and hypertension, at least 2. Now, when you are 70, 50% of the population will have at least 3, hypertension, diabetes, and maybe hypercholesterolemia, etc. So these are real challenge. The only way we can actually reduce the curative part is actually to focus more on preventive measures. Now, the lifespan, as you can see, we want you to age gracefully, in terms of, and age healthily. But if you 50% of the 60 and above already have 2 comorbidities, and whereas 50% of them already have 3 comorbidities, then I think there will be a lot of issues and challenges with regards to maintaining a life expectancy. So these are the issues that we have in terms of progression. Sometimes when you age, you also have osteoarthritis, and a lot of aging issues. And our healthcare perhaps not focused on the aging population. That's why we try to train more geriatric medicine, and obviously try to shift the pendulum from curative of the aging population to preventive. So we want our population to live longer and healthier. So that is the key. Now, and this is the life expectancy, as you see, and therefore chronic inflammation, for example, osteoarthritis and etc. Can we manage them? Can we help them? Because at that stage, they should have actually prevent, but then more important is that when they have the disease, how can we actually help them? And this is where the tissue regeneration is important, and whether we can actually embark on research to help this group of patients. Therefore, you look into growing interest in a regenerative therapy, such as mesenchymal stromal cells, derived medicinal product. which aim not only to relieve the symptom, but potentially modify the disease progression. So we can actually slow down the progress of osteoarthritis, for example, and to reduce the inflammation, to promote cartilage remodeling, and also support the cell growth. So again, this is been done, and then I think a few stem cell mesenchymal cell research have been done. There is actually one product in the pipeline, and we hope that it will get registered as soon as possible. The clinical trials already completed. They can actually use this for the treatment of osteoarthritis of the knee. So just to summarize in terms of the cell review, in each cells there are small unit of life. The cells are composed of 4 main parts. You have the nucleus, whereby your DNA is there. You have membrane, you have the organelles, and you have the cytoplasma. This is the structure of the cell. Then the cell form tissue, and from the tissue, then many form of tissue then will form the organ and the function of the respective cell. So our DNA is stored in the nucleus, and then from DNA you can see there's a cell, smallest unit of the life in the body. Then from the cells they form the tissue, comprised of many cells to form a functional unit. And from the tissue comes the organ, comprised of many tissue to form a functional unit, and then to the organism, that means a human, forming a human being, multiple organs, and these organs are derived from each tissue. So we start with the cell therapy in terms of whether we can generate cells to replace the injured cell or aged cells. So in a single day, we lose and replace about 50 to 70 billion cells. So this is, every day we are losing. We have new cell formation, and there's a strike of balance between new cell and old cells, dying cells. So, if there is no balance, then you have tumor. Tumor is a growth, uncontrolled growth of cells. And if the cell can spread, not only tumor is a benign tumor, but if it can spread, then become a malignant tumor. So our body strike a balance between new cells formation and the dead cells. Then the organ can remain as it is. So what are stem cells? These are the things. Stem cells are the foundation from which every organ and tissue in our body grow. Stem cells are the foundation from stem cells are defined by 2 properties, and you can see here in terms of the properties, they can actually differentiate. They self-renew, that means they continue to regenerate and make copies of themselves, or they can differentiate to develop the more specialized cells. So these are the 2 main functions of the cell. So what do stem cells do? Obviously, if you look into stem cells, for example, if you have injury, your body will repair the injury itself, and this is stimulate. For example, this is a healing process. This is in our body. We all know about this. We all read about this, and the body can regenerate new cells. For example, during injury, there will be bleeding. After the bleeding, there will be clot formation. Once the clot formations, then you can see stage 2, the inflammation. You can, in terms of swelling, redness, and as inflammation of the area. Then accumulation of the neutrophils and macrophages, and the inflammatory cells and the growth factors will release. Then you move to the stage 3, that means 2 or 3 weeks later, whereby the proliferation, that means angiogenesis occurs, proliferation of the fibroblasts, epithelialization, and then once you form that, the stage 4, about 6 months to 1 year later, then the remodeling, the collagen deposition and remodeling happens. This is automatically already in our body. The only question is that how can we optimize the body to recognize and also to control the cell growth? This is the challenge. And in the proliferation phase, how were new skin and blood cells created? So this is something that we need to look into. The stem cells can differentiate, become more specific, or they can regenerate the same cell, replicate and regenerate. So we see stem cells becoming fully differentiated cells in wound healing to create new skin and also blood cells. So this is something, as Prof. Sim have mentioned, things are evolving very fast. What we learned yesterday may change, may be better today, and tomorrow new knowledge probably will help us. So other stem cell function, you can see a growth of the new cells, hair cells, for example, regrowth cartilage of the bone in osteoarthritis, heart muscle after myocardial infarction, for example, regrowth after a heart attack, and damage to the intestinal lining is also critically important. So the types of stem cells, you can see the type of stem cells that we talk about. These are some of the type of stem cells available: embryonic stem cells, mesenchymal stem cells, and then they can either de-differentiate, or they can actually replicate to form the cells that we need. So these are the stem cells can be collected from one person, from another person at a very early stage, and then the common sources include, for example, amniotic fluid, placenta, umbilical cord, and then we get all these cells and continue to grow them, and then they can differentiate to our requirement, for example. This is mesenchymal stromal cells, multipotent cells used in repair and modulation. So, as I said, one company in Malaysia already have done the clinical trials in osteoarthritis. Hopefully, we can register the drug and then to stimulate the cell growth in osteoarthritis. So again, are stem cells treatment approved by Ministry of Health? This is the big question. At the moment, there's only Ministry of Health have only approved one drug, that is Zolgensma. This is only drug that been approved. The pharmaceutical NPRA has approved Zolgensma on February 2024, only last year, for gene therapy authorized in the country, since control over the cells and gene therapy products began in 2021. And as of now, no other cellular-derived medicinal product has been approved by NPRA. So there's only one drug. This is Zolgensma, is used for spinal muscular dystrophy. This is at age for in a baby less than 2 years old, for example, you can use. But this is a very expensive medicine in terms of registered in NPRA. Other than that is all clinical trials and research, and we hope that the clinical trial and research will have a positive impact, like Zolgensma, that we can use for certain diseases like osteoarthritis and etc. So NPRA acknowledges some products of the controlled use. Some companies may receive acknowledgement letters from NPRA to proceed under hospital-based or named patient program, especially when used for clinical trial, research, or compassionate use. But it's not marketable, market available. This is not the same as the market approval, but permits limited usage because we need data to show the long-term effect of the drug. So this is certainly an ongoing process, and the cell therapy can be used under the clinical trials. Some of the clinical trials are using cell therapy, namely under the license clinical trials for investigator license and the medical research and ethics committee approval. Then we can use some of the product. So how much does it cost for a stem cell? So it's not cheap because this research needs a lot of funding. And I just mentioned a few. You look into the cost of, we are talking about hundreds of thousands. And Zolgensma almost costs millions, in terms of per patient. So that is not cheap because new discovery will be expensive, and hope that if more people are using, then the cost will come down in time to come. So the next question is, are there any stem cell treatment approved by MPRA in Malaysia? This is the most important, whether approved or not, with regards to stem cells. With regards to tissue culture, for skin culture, that has been approved, can be used. But this is like Zolgensma is a product that means it has to be registered and then before it can be used. So as far as today, the product therapy stem cell, only Zolgensma has been approved. Is an injection form. This is the drug that has been approved and MPRA. No other, although there are in the pipeline, there are many drugs under the clinical trial, but none of them has been approved yet by NPRA. So in regenerative medicine, it is very important to strike a balance, the tissue engineering to regenerate and grow new cells in cellular therapy leading to stem cell research. So we need to strike a balance between innovation and regulation and safety. So the most important is the safety of the product. So in the long run, we need to look into the outcome as well as the side effect of certain drugs. So it's not like, when you have a side effect, and once you've been given to the patient, you cannot recall back the cells because the cells are already in the body. Unlike a car, something is wrong, you can recall back the car. But this is a challenge in terms of stem cell research for us to assure and register the product and make sure that it is safe and doesn't cause tumor, cancer, and etc. So we need to strike a balance between clinical trials and research, and also to make sure safety comes first. So I think this is just a bird's eye view of what stem cells is all about, and thank you for your attention.